that I have. This was not intentional. So, just a few things to talk about. Of course, we all know that monkeypox is kind of a, well, not terribly new thing, but it's maybe a little bit newer than COVID that we've all been living and breathing for a couple of years. Um, as of yesterday, there were documented a few more than 200 cases in Orange County. So this is far less than what they're seeing in LA County, but this is what we have locally. And there's two things to really think about. One is treatment with tecovirimat, and probably saying that wrong, so I'll just call it TPOXX. And then, of course, there's prevention with Jynneos, which is the vaccine given intradermally, 2 doses, 28 days apart. One of the things that I thought it might be interesting for us to think about is a little bit more information about Jynneos itself. So it's actually indicated for both the prevention of smallpox and monkeypox, and it has an emergency use authorization to be given under the age of 18. The vaccine can be given either subcutaneously or intradermally, and the current recommendations to give it intradermally are in consideration of the limited supply that we have. So the intradermal dose is much smaller. So you can get, because of the volume difference, you can get 5 intradermal doses from what would be 1 subcutaneous dose. It can be given with other vaccines, and it's fine to give if the individual is either pregnant or breastfeeding. Moving on to TPOXX. Does somebody have a question or a comment? If so, just let me know at any time. Moving on to TPOXX, which is available both orally and parenterally, but I did focus mostly on the oral formulation. So this has an expanded access EUA for monkeypox, also for under the age of 18. Its mechanism is it inhibits the viral envelope wrapping protein. The actual indication is for treatment of smallpox, but it does work for monkeypox as well. And it should be taken within about half an hour after a moderate or high-fat meal to really promote the absorption of it. And the notable drug interactions include repaglinide, which I haven't seen anybody on that in probably 15 years, but there's an increased risk of hypoglycemia, and then also midazolam. And the concern there is that the midazolam might not be quite as effective. So moving on from that, something else that seems to be pretty relevant for all of us to be aware of is the dramatic increase in perpetuation of fentanyl, particularly rainbow fentanyl, which that's concerning because it's manufactured in these brightly colored tablets. Apparently there are some that even look like Legos. And of course, this is capturing a younger and younger group of users, which now the data here, as we see, is in LA County, but you can see just dramatic increase in overdose deaths. And of course, LA County is not that far away. So what they see there, we might also see here in Orange County. Some of the other formulations, so there's the pills, I mentioned the Legos, it's available as a powder, like this formulation that looks almost like sidewalk chalk that children might have. And of course, we all should remember that fentanyl is 50 times more potent than heroin. And one thing that we can all do as pharmacists is to just be aware that, of course, naloxone is an effective intervention, and think about how we might be disseminating that information to our patients. So that's my quick update for the evening, and just a few slides to get everyone thinking about these things. And now, of course, we'd like to open up and think about, what have you seen in your practice, and have you heard about these things?